Welcome everyone to our public health education series on vector preparedness. Today is part one, which will talk about vector control preparedness. Before we get started, let's go over a few housekeeping rules. First, everyone please mute your line. You can use the chat box to ask any questions. For additional questions not answered during the webinar, you can email us at education@nola.gov. The webinar will be posted on our YouTube channel, and I'll put the link to that in the chat. And this webinar is approved for LA Sanitarian CEUs. Today's speaker is Dr. Claudia Regal, the Director of Mosquito, Termite, and Rodent Control Board. She earned her degrees from Purdue University, the University of Georgia, and obtained a PhD from the University of Florida. In 2004, she became Principal Research Entomologist for the City of New Orleans Mosquito and Termite Control Board. In 2006, she became Assistant Director, and in 2010, she was promoted to Director of the department. And now, Claudia.
Thank you so much, Astacia. Thank you, everyone online, for taking a little bit out of time out of your day to listen to a very important topic, which is vector-borne disease control, prevention, and really improving your preparedness. So today I'm going to talk about mosquito control, but also I'm going to touch on rodents because it's very important. They're the carriers for fleas and mites. And this is really going to be a little bit of food for thought, things that you can really start to think about and to put in place so that you can be better prepared when an event happens. It's really a matter of time. So something's going to hit your geography. So vector control preparedness is incredibly important. If we think about it from an all hazards standpoint, it can be a hurricane, so wind and flood, of course, tornadoes. You can have infrastructure breakdowns. You can have disease, such as we have seen with COVID-19 and rodents, but Zika virus, all of that is very, very important. So there's a huge need for vector and urban pest control, and there are quite a few reasons. But the first, of course, very important is for it's very important is disease transmission to human and animals, including emerging diseases. So it's very important for everyone to look beyond your borders, and we'll talk about that in a few minutes. Big events such as hurricanes or massive tornadoes, there's a lot of people and pests that and animals, excuse me, that are often exposed because they are repairing their homes. So there's a lot more exposure after a disaster. Definitely mosquitoes interfere with recovery, especially in South Florida, Louisiana, and other places. Just you can have huge numbers, huge populations of floodwater mosquitoes. And as we all seen in 2016, you can also have economic impact with tourism and travel. Nobody wants the CDC, the Centers for Disease Control and Prevention, to put a box over your city or a particular area saying, hey, don't go here because of a particular disease. So definitely can impact tourism and travel. So we are in the hurricane belt here in Louisiana in the Gulf South. And so let's just talk a little bit about that first. But with hurricanes, after hurricanes, there are a few pests that show up pretty quickly and some over the course of time. So the first ones, of importance here, we're going to talk about mosquitoes and flies and wildlife, stray animals and rodents. But the first ones you're typically going to see, especially if there's a breakdown in trash pickup, are going to be those flies. So those flies come out pretty quickly and often they're everywhere. We see a lot of wildlife and stray animals out there, but then if the power's out, usually about a week, 10 days after, you start to see mosquitoes, especially in areas where there are a lot of fountains and ponds and things that don't have electricity where it should be running. We do see rodents, but rodents too become very affected. Depending on where you are in the country and in the world, you may have roof rats and Norway rats, or you may just have Norways. But if you have a flooding event, you will have quite a few that die, but many survive as well. We'll talk a little bit more about it. So this was in 2021. This was after Hurricane Ida. And as I mentioned, we can have huge numbers of floodwater mosquitoes that interfere with the work we're doing as people are out in their homes trying to repair, clean out. Typically, right after an event, people are cleaning out, especially if there's flooding, moving everything to the street. And these mosquitoes can be very aggressive. They're strong flyers. And really can interfere what people are doing. So this trap count was around 11,000 mosquitoes caught in 24 hours. That's a huge number. And as people are outside repairing their homes, so this was a nice study done in 2005 and 2006, they actually found a twofold increase in neuroinvasive West Nile virus in the hurricane affected areas. So that's so important for people to know that, because as people are repairing their homes, they're outside, they're exposed, in confined spaces, especially with the folks that were in FEMA trailers. So very important to wear repellent and just to have good awareness that mosquito control is extremely important after one of these events. Now, you can be almost anywhere in the world in just a few hours. So the lines that are there are airplanes that are routes that are in the air at the same time. So just amazing, right? How many flights you can go from the United States to Africa or to Central or South America in just a few hours. And so you're enjoying a vacation at somewhere. Right now, there's a really big epidemic happening with dengue virus in the Caribbean and South America. So you can go on a wonderful vacation. You're at the beach or a resort or whatever it may be, or walking around town. You are bit by an infected Aedes aegypti mosquitoes, let's say infected with dengue. You get back on the airplane, you don't have any symptoms because it usually takes a little bit of time for those symptoms to develop. Come home, you're not feeling great, and there you are. You're now a travel case of one of these pathogens. So very important to be aware of what is happening. A great example of that was the introduction of Zika virus in 2016 into the United States. And again, we really were watching what was happening in South America, in Brazil, actually, in the Caribbean, and then what was happening in Florida and South Texas, right? So a big issue. And as I mentioned, dengue is the situation today. And so again, those vectors, Aedes aegypti and Aedes albopictus, with Aedes aegypti being a little bit more important for transmission. They like to feed on people. Dengue is your pathogen. It's a virus. And so again, very important for us to be watching what is happening worldwide and around your borders so that we understand what are the risks locally for that. So for New Orleans, we have both Aedes aegypti and Aedes albopictus. So we have to stay alert. Our state epidemiologists do alert us when there's a travel case. And so they tell us the date that the person became symptomatic, when they arrived into New Orleans, and when they sought medical attention is usually important. And so very important for us to know, because we don't want that virus, dengue virus, getting into the local population of Aedes aegypti or Aedes albopictus. So one of the things we learned, especially in 2016, and we're going to talk a little bit more about mosquito control, but this isn't the distribution of Aedes species, of Aedes aegypti and Aedes albopictus. So it's where they could live, right? And so it's very important as temperature changes, those expansion of those host range probably are going to increase. And so locally in your own jurisdiction, you need to be asking these questions of what species are here, and is this important? And so it is important if you have Aedes aegypti in your area. So again, one of those things, work with your local universities or your local mosquito control districts in order to identify the location of these mosquitoes. So I'm going to toggle back and forth, right, from mosquitoes and rodents, because I think this is a really great example of preparedness here at the City of New Orleans, allowed us to really pivot and move pretty seamlessly into pretty aggressive rodent control after the city shut down with COVID-19. So here's a picture there of a Norway rat that was on Bourbon Street. So Couple definitions here of vectors, very important. So typically the mosquitoes and flies, kissing bugs, mites, fleas are the ones we're going to be thinking about. They often take a blood meal, which is pretty important. And but there are other animals out there too. Rats can transmit disease, mice, raccoons, bats are other examples. But for the mostly the context that we're talking about, these are those blood-seeking insects that are there. And again, with rodents, you also have compounding issues with which they're also the reservoir for fleas and mites. For mosquito-borne diseases, there are a lot of them out there. And so again, it depends on where you live, right? What your risks are and what types of pathogens you have. Just last year, do you remember how a lot of folks were talking about malaria and, cases of malaria and what was happening? Well, fortunately, we had the ability and the tools and the know-how, staff with the right skill sets to actually collect our Anopheles mosquitoes and actually test them to see if they had malaria. So it helped really get good information out, not only to administrators, our program to make decisions, but to the public as well. But chikungunya, Zika, dengue, yellow fever, there's a lot of other ones. And don't forget about the like dog heartworm, very important for our companion pets, very important area here in Louisiana. You really need to do prophylactic treatments because it is otherwise likely that they're going to get heartworm. So very important. Now, when it comes to rodents, they can be directly transmitted by rodents, and this is just a list from the Centers for Disease Control and Prevention. Again, it's one of those situations that we're looking at this in a worldwide situation. Not all these diseases are going to be found in your jurisdiction, but it's important to know what is out there and really what is the situation worldwide. Now, what also happens is that these rodents can indirectly spread by their ectoparasites. And so some of these are very important for the United States. And again, I'm going to sort of refer you back to your particular area, and hopefully you know where some of these different pathogens are going to be prevalent or not in your particular area. Now, when we think about preparedness, it's very important to have a response plan. And so there's a few things you need to have. Now, I'm going to tell you straight up, you can't do it all in one day, right? So, or even 1 year. And so for us, it's really been decades of learning and building programs and building our program and adding certain level of resiliency and capacity so that we can continue to grow the program and service our particular jurisdiction, better, pivot a little bit better. So if there's a particular issue, our staff's already trained, able to change and deal with the situation. But I think these are the basics of what you need to have, and one is a response plan. So at least people know what you're going to be doing. And so actually right now we're updating our mosquito plan for dengue virus. So we had one, we started actually when 2016 came around with potentially Zika virus, we didn't have a plan. So we needed to create one, not in a vacuum, but with multiple agencies, the New Orleans Health Department and Homeland Security and a lot of other folks, so everyone knew what would happen when. You have to have a surveillance program. That means collecting mosquitoes or whatever pathogen or vector you're looking for. In some cases, it's even virus testing or pathogen testing. You have to understand if there's resistance or even tolerance to those insecticides in your population of mosquitoes or whatever insect you're dealing with. And you have to be able to manage that data somehow so that you're able to look historically and look at trends that may be happening. Also creating that infrastructure, right? So even for mosquito control, it's very expensive. If you're buying a new aircraft or even a spray unit, a new vehicle, these are tens of thousands of dollars. So you have to budget and plan and convince, right, other usually administrators that it's important to have these tools. Supplies and insecticides, very important, and it needs to be validated against your local population of mosquitoes. You need to have trained personnel, and contingency contracts are very important, especially if you don't have aerial capacity or enough people in your agency to do this work if there were to be a local outbreak. Interagency cooperation, I talk about this all the time, is breaking down the silos. We need to talk to other agencies. We often have the same goals. We might approach it in a different way, but it's a great opportunity to leverage and discuss and innovate. So those are all very important. And then finally, have some sort of plan that you're able to do education. And that's not only the public, right? But it's also educating your government officials, your medical professionals, so that they diagnose cases correctly. Your port and airport officials, are they making announcements at baggage claims so that people understand what their risks are? And of course, very important, the public. So anything we do here at the City of New Orleans Mosquito Control is in an IPM fashion. So we're going to go through a few of these things and talk a little bit about preparedness and some things that you might be able to do that will help you. So we're going to talk about surveillance and source reduction, the use of insecticides. Resistance testing is one of those important pillars for mosquito control, biological control agents, and of course, public education. And when it comes to rodents, we also use an IPM plan, but it's a little bit different, right? So of course we are going to do public education. We're going to continue to do those inspections, and really we say surveillance here, but it's mostly some surveys. Sanitation is absolutely critical. Exclusion may be what you need to do, and of course a use of different tools for population reduction. So let's talk a little bit about terminology, survey versus surveillance. And again, think about what your resources are and what you can do. And a lot of times, starting with a survey, which is a one-time gathering of information so that you can assess that situation, is what you can do. But you want to move it towards a surveillance program, which is a continuing process, right, to monitor those changes. And in this particular case, it's mosquito populations, right? But whatever your vector that you're dealing with, you need to have some sort of surveillance. It's really important to tell you when you need those control measures, but it's also extremely important to tell you if the measures that you took are effective and they worked, right? So you use it for a variety of reasons. So here's just a map of New Orleans. You can see the little red dots. Those are where we have our static trap placement locations throughout the city. So we put our mosquito traps out every Monday. We pick them up every Tuesday. The mosquitoes come back to the lab. We've got a bunch of folks that are identifying mosquitoes to species. And then those mosquitoes are then go by Wednesday morning. They're being driven to Louisiana State University for testing to see if they have an arbovirus. So we usually know our results by Friday morning or midday, and then we can take those actions then. Now, I wish there was a trap that would collect everything, but that typically is not the case. And so you may need a variety of traps. It really depends on what your target mosquitoes are. And it's very important to identify the mosquitoes to species. And so that way you know what species there are. And of course, you may divide them out for different kinds of arboviral testing, but it's very important to know what those main vectors are in your region. So this is a great example of working together. So the state of Louisiana does a great job with their statewide arbovirus surveillance program. There's actually money from the state legislature that is dedicated towards arboviral surveillance program. So I've been in the state for 24 years. So it started before that. So really exciting. And so money goes to LSU, the veterinary school, where they have a laboratory that is really made for doing this kind of testing. And so what happens is mosquito abatement districts are able to collect those mosquitoes, send them off to LSU. And typically, of course, there's funding from the governmental side, but we now pay a little bit. I think it's $3.75 a mosquito pool, which is very affordable. So it really encourages districts to submit their samples. But what happens is there's a lot of communication between the districts, the state office, the state veterinarian, and then eventually it gets into the federal system. We're now using VectorServe, so it goes on to a different platform where everyone has access. But by Friday, usually midday, we get an email from Louisiana Mosquito Control Association letting us know how many positive pools were found in different parishes throughout Louisiana. So it gives us a really good idea of what's going on statewide. All right, so for source reduction, whew, this is tough, right? And I think everyone who works in mosquito control deals with this. It's really understanding at the bottom, right? You've got the tires there that have been, we have terrible problem with tire dumping, and there's been a lot of enforcement that's put in and a lot of cleanup, which is very important to reduce, and also education, right? And showing that it's not okay, it's actually illegal to be doing this. But we have to really understand what the bulky waste laws are, understand what is the process, right? And so that we can work with different agencies to eliminate this problem. And then, of course, working with households where that's the top left, where they're leaving a lot of containers and all of that. So what are your local rules for enforcement, right? Usually we want to start with education, but there are egregious cases that whatever education you do is not going to change. So it's important to understand what your local capacity is. And again, what happens if you have, let's say, a dengue virus local case, local transmission case? Are you able to go onto that property, or do you have to be allowed onto that property? So through an emergency declaration, or what are your local laws? So you really do need to know that. And if you need to make changes so that you can access these properties, you need to do it before there is an emergency. So we talked about this a little bit. This just shows to 2018, but lots of tires have been removed, discarded, wasted, tires, and lots of different folks at the city of New Orleans and the state work together to really minimize this. Unfortunately, they've been able to bring some folks to court because of it. But one of the things we wanted to know is, well, is Aedes aegypti mosquitoes a huge problem in these tires? And I'm going to go back to Zika virus in 2016, and that would have had huge implications. But what we actually found is that our Culex quinx, our southern house mosquito, was a bigger issue, and also Aedes albopictus. And so again, think about those tires that maybe your resident doesn't know how to discard them, and those tires are sitting underneath their porch, underneath a staircase full of mosquitoes. And so we ended up doing surveys and some education with the public, and we created new documents because of these different projects that helped really educate some of the folks that live in our area on how to dispose of tires. All right, so let's talk a little bit about adulticides. And again, I know some folks maybe have smaller programs, and you might be thinking, well, how do I even get to having an airplane, right? Or having the spray equipment. But it's really important to understand the different types of treatments that you would do. And so, of course, most mosquito control districts are using ultra low volume adulticiding. And so typically it's ground spraying that you're going to see. You may actually have some folks that do yard treatments with ULV as well. And so very important to have the staff that you understand the process, and that timing of application is very important. So that top picture, it looks like spraying during the day, but our program does not spray during the day because we do not want to hit any of those non-targets. And again, but we also want to focus on when the mosquito is most active. And so very, very important for your timing of application. Make sure that the equipment is calibrated. Good thing is, if you don't know how to do it, many of the manufacturers have the capacity to come in and help you do it. So you just have to look and see what resources are there. Residual treatments are another option for doing yard treatments. We typically see these more in the private industry if it's mosquito control type companies that do yard treatments, or even in pest management. So again, very important to understand resistance, but make sure that if you are doing those applications, that you're really looking at drift and avoiding that. You're following the label all the time. You're not treating flowers where some of those pollinators might be, because we don't want to have those issues. Now, we'll tell all of you that it is very important to do larviciding. Sometimes we don't think about that, especially in the private industry, but it is incredibly important. And it is used often in area-wide scenarios for arboviral prevention, really during those adulticide, larvicide treatments. Zika was a great example that until there was alternating treatments of adulticide and larviciding, that's when they really were able to stop the transmission. If you're doing it on a large scale, pretty expensive. If you're doing it on a local scale, very affordable. So all the folks that might be in a pest management industry that are listening to this talk today, you need to have a variety of different larvicides, and you need to know how they work. So it may be targeting a different life cycle or a different part of the life cycle. So again, targeting mosquitoes within ULV application. So as I just mentioned, we want to do it during the peak activity time for these mosquitoes. And so sometimes it's just right after dark. Sometimes it's late at night, especially with our southern house mosquito. So again, very important to do the adulticide larvicide application, especially if you have the capacity to do area wide. And so important again too is to look at what is going on, and you may have to say, hey, today is not a good day. There might be rain. You have to make sure your droplet sizes are calibrated correctly. Your equipment, everything needs to be done prior to these emergencies. Now, if you don't have this capacity, and you won't have this capacity, if you are looking at a contingency contract, all these things need to be written in so that you're getting exactly what you're asking for in the event of an emergency. Now here's an example. I'm just giving you all an example of what we did, because in 2016 we did not have the capacity to do area-wide larviciding, and so we had to really go by equipment and test what was out there. And unfortunately, we were able to do that, and so we did it in different phases. Of course, also looking at it with a rented helicopter. But then we also looked at different types of ground equipment. It's much more affordable for a program to be able to do this. And so again, you need to test it in your particular area and make sure that it is in fact working. So there's lots of different programs out there. There's lots of different peer-reviewed journal articles that talk about the methodology and how to do this type of work. Let's talk a little bit about resistance, which is incredibly important. And so one of the things that we really want to focus on is that good product stewardship. And we want to make sure that you are not using products that aren't effective, right, against your local population of mosquitoes. And so resistance is going to vary tremendously from area to area. So it's important to check your population. What we want to do, though, is, again, look and see, and you want to avoid resistance before it happens. So very, very important. These are just some examples. Actually, the Centers for Disease Control and Prevention has kits that you can buy, or not buy, excuse me, they will provide it for you to do bottle bioassays, type of tests that you can look at for testing your local populations for resistance. And so there's lots of information out there. If you're interested, we can get you more information, but you can also visit the Centers for Disease Control and Prevention website, and they've got information on how to receive the bottle bioassays. And a lot of times you may have to have some capacity to rear mosquitoes. But what also happens is that what we're finding is that there are mosquito control districts that partner with university professors or other agencies to actually have their local populations of mosquitoes tested. So there's lots of ways to get this information. There's some other fancier tools out there, a little bit more expensive. You can look at these with different types of molecular tools out there to make sure that what is going on, at least this is for KDR knockdown genes. So just to see if it's those genes are in the population that you have. You often need to follow up, right, with maybe a cage trial with a particular formulation that you have of the insecticide, but this gives you a pretty good idea of what is happening in your local species of whatever you're looking at. So this is a great example here from 2018. And so again, we can see all the spray zones that we have. They're all listed there. So lots of different spray zones across New Orleans. And the spray zones are really what one of our inspectors can treat in about 2 hours. So that, they're different sizes. But what we found is that Aedes aegypti at the time was pretty susceptible to different types of pyrethroids. So that was pretty great news. But what we found is that, this changes. And so it's important to check your populations on a regular basis. And we hadn't checked it for about 5 years. And last year, just to look, took some of the Aedes aegypti mosquitoes and looked to see what was happening, and it was a completely different story. And what we were actually finding is that there was actually quite a bit of resistance in the population. And so one of the things we're going to be doing this year is really doing a deep dive of New Orleans to see what exactly is happening. So very important to check your populations because things do change. When we think about educating different people, it really, we have got a pretty wide audience here in vector control, and you have to educate different groups of people. It might be your administrators, for example, your mayors, your finance directors, your chief administrative officers, folks like that, that really, have to have an understanding of why vector control is very important. But you also need to educate your own employees. And then we work with universities and everybody else because everybody brings something different to the table. So it's really important that everyone understands what basic mosquito abatement really is. Now, it is incredibly important to collaborate and to talk to folks. Great examples here, and I think Louisiana does a really great job with their mosquito control districts. We have a very strong Louisiana Mosquito Control Association in our state. Those annual meetings, they're very well attended. They're typically around 200, 220 people. And they come from all different parts of the state and outside of the state as well. And so it gives us an opportunity to collaborate, to discuss, to learn more about what's been happening. But that's at the state level. But you also need to do that in your own municipality. For example, if you're working in a city, we have a health department, a local health department, but we work with them hand in hand. And we also work with the epidemiologists and other groups as well. So very important because it does help encourage collaboration and then also supports better decision making because we may learn something that somebody is doing or they may have a better idea or a new piece of information that we need to know. It does boost productivity because you've got a lot of folks working towards that same goal. And I also think it fosters innovation. So just new ways of doing things. Maybe there's a new tool out there or a new way of tracking data. You might learn something. So it's very important to work together. Now, when it comes to education, especially of the public, we need to look at all types of folks that are out there. Great example here, of course, during an emergency, we're not going to be going into schools, but really getting to those school children if you can, very, very important. A lot of focusing on the private industry. Those are folks that are out there, again, we talked about breaking down silos, right? That are out there doing this work. So we all need to be working together. There's going to be folks that are never going to pick up a cell phone. Well, okay, I think everyone's got a cell phone, but maybe they have a flip phone and not a smartphone. All right. So if you're pushing everything through social media, are you really getting your entire audience? They may want something in print or by radio. So it just kind of depends. On the other hand, you have folks that they're only going to get their information from social media. So you have to have those types of content ready to go. Now, when it comes to mosquito control, there's just a lot of misinformation about the use of insecticides for area-wide treatments. And so you will have folks that no matter what you do, however you explain it, they want absolutely no insect, and however big the risks are, they want no insecticide used. So you really need to have that in place and understand how these products work and what information you need to be providing. So of course we love doing outreach and trying to be a little bit innovative, but these are one of the little tools that we've used. And these are bookmarks, And they're great because you can put them in libraries. We put them in schools. People really like them. They're pretty durable. It's just a nice cardstock. But again, it's just basic information with our contact information and letting them know where they can get more information about what we do. So these are good little tactics that you may be able to use for your own programs. As far as social media, it's a pretty powerful tool. And there's different ways of communicating with folks that are out there. We actually use some online platforms that are inexpensive, easy to make content. You can see here we're talking about pest proofing, rodents and commensal rodents, and the importance of not leaving pet food outside. There's a lot of myths out there for rodents and mosquitoes. So it's important to push that information out. And also you can see there's a picture of a dumpster. What are the local rules? You know, people may not know that. The commercial folks that maybe have a restaurant may not know what the rules are on trash handling, or even your residents. So really super important to have very clean, short messages in little bites that people can digest. Lots of training out there for the technical folks as well. I think this is a very important thing. Look, there's a lot of people doing wonderful work out there. So it's important that, again, you know, we're really pushing the right information out and best practices and what can we all do to protect our citizens. Now, when it comes to educating, everyone needs to be on the same platform, essentially, really with the same message. So these are just photographs from the past, but there's our previous mayor, Mitch Landrieu, some city council folks. You can see me all the way in the back, right? But this was really when Zika virus was knocking on our doors and we needed to be prepared. The picture below, you can see our current mayor, and she also has a really good handle on what's going on with mosquito control and what are best practices. But again, it's working with your state epidemiologists, it's working with the council, it's working with your communications office, whatever policies you have. But when it comes to preparedness, it's about getting these things done early and prior to the emergency. So very important to prepare some press releases, and you need to have unified messaging, because when it's not, it really creates an issue with mistrust. So make sure you know who your state epidemiologists are, know your communications, your folks at the city, health department. Everybody needs to know each other so that there's these discussions prior to any event. I think most cities, especially a certain size, right now what day is today? We are right in the middle of beginning of hurricane season. So there's a lot of webinars and training that happens on how to approach emergencies. And so again, very important to have these communications prior to any event so that everybody can work together. Who are you communicating to, right? So the document on the left-hand side, really great for our pest management professionals, give you some basic information on the mosquito and, you know, all the things that you need to know about them. But we also need to educate healthcare providers, veterinarians, pest management, all those folks. And so we're going to use a little bit of a different tactic. But again, we need to be doing these things before an emergency arises. So we're going to shift a little bit to rodent, and we're really going to use that COVID-19 as an example, because I think for most of you out there, if you have a rodent control program in your area, or even if you didn't, it was all over the news internationally, right? Where rodents were coming out on the street, they were hungry, and what were people doing? So I'm going to tell you a little bit about what was done. So let's focus a little bit now on rodent control preparedness. So it's going to be a little bit different, but there's going to be some common points, right? You need to know what rodent species are in your service area. Unfortunately, there aren't a lot of programs in the US. It's not so great. And so, but there are universities that are working on this. And so it's important for you to know. You need to have a well-informed and funded municipal or state rodent control program. That's the base, right? Private industry is out there, but you need a base. Very, very important. How does the public tell you where they're seeing rodent sightings. Are they using 311? Are they calling your office? Or is there no vehicle, right, for them to even tell you? So I'm going to tell you all, I don't know of any true rodent surveillance program, okay? However, I know there are lots of surveys that are being done and there are checks, right, on certain things, but it's very important to have one. And so it's a very complicated subject, but really important that we really crack the nut, right, I say, to figure out how we can create a surveillance program for rodents. Look, interagency cooperation and information sharing, absolutely critical. Great example here is our state health department. They do encampment cleanups. And so there are about 15 different agencies on those emails, and we're one of them. So everybody's working together and sharing information. Well, when it comes to rodents, you need to know what's happening below ground. So understanding your infrastructure, your buildings, but your sewers, what is out there where they could be harboring. And I'm hoping that you are working with your pest control industry, because honestly, this is the group of people that's primarily doing rodent control in our country. You need to know how the tools work, right? How do you use it? Do you use rodenticides? Not if you're in California, you're not using second generation rodenticides, but you might be using it somewhere else. Do you have the capacity to use carbon dioxide? Do you use non-active baits? All those things are really important. Public awareness, really super important, right? That it is important to manage rodents. And we really, in this case, need participation of the public in order to get a handle on the situation. Now, when it comes to mosquito control programs in the US, guys, not so great. There's some really wonderful programs, okay, out there, but as a whole, not so great. There aren't that many. Not all cities, I would say most cities do not have a program. And some cities at least have the ability to have a call taken by the 311 centers. Those are usually a little bit bigger cities. Funding levels are all over the place, from very little, where essentially they're giving a bait station to a resident, to really well-funded programs that really do a lot of inspections and dealing with residents and all. You have to really, look, public or private, sometimes the service is provided by contractors and not the public agency. The contract is managed by the public agency. Some places have programs, outreach, and many do not. And but I will tell you, one of the things I've seen is that programs often are working in silos, right? And when it comes to rodent control, it is absolutely critical that we do not work in silos. You have to break them down. And that is understanding code enforcement, private industry, health, housing. I mean, it is all there. So you really do need to understand. There's a great paper by Michael Lee. I put the citation there. You can read more about it. He's got another paper as well, but he interviewed a lot of different mosquito control programs, and so gives you an idea of where we are. So again, depending on where you are in the United States, you might have both the Norway rat and the roof rat. House mouse, pretty ubiquitous, and these are commensals, all right? So your white-footed mouse, those are not what I'm going to be necessarily talking about, but those are very important in different parts of the country. So again, still some of these basic concepts are going to work with some of those other mice. So what makes a rodent a really great agent, right? If you look at it worldwide, lots of species out there, they're incredibly opportunistic. So let's go and talk about our commensal rodents. Very high reproduction potential, especially if they've got a place to live and lots of food nearby. There are going to be lots of babies, okay, which allows for those populations to increase pretty rapidly. And they're paradomestic, right? So they're around our homes, our businesses. We give them everything that they need to survive and to thrive. And so when you think about what that urban rodent problem is, one, contamination of food. I mean, worldwide, this is a huge issue with rodents contaminating grains and food. But think about it in potentially a restaurant where you may have a rodent infestation and the flour and products are not placed in bins that are closed. You might have droppings inside, and as rodents walk, they are also urinating, so contaminating with that as well. They can absolutely destroy and damage property. Wires, you can see that's a great example at the bottom right, where they have chewed those wires. Fires can also occur. Disease transmission. We don't have a ton of cases in the United States of health outcomes that are associated with rodents. However, worldwide, a huge problem. However, I do think that it's not likely diagnosed. All right, so maybe you go to a restaurant, it's infested with rodents, you don't feel well. Was it because something was wrong with the temperature of the food, or was it because you just picked up a rodent-borne pathogen, right? So we don't really know, and doctors don't typically check. Asthma, absolutely important, right? Very, very important. That's been well documented. And look, I will tell you, I think any that works for any city, you do not want your city to be known for having, rodents. And so very important. And again, we'll go through this pretty quickly, but lots of different ways of transmission through direct contact, indirect contact, vector-borne disease. Murine typhus is a great example with flea. So very, very important to manage not only the rodent, but the fleas that are in that environment as well. And then, of course, you can have foodborne, just the example that I gave you. You can have something that's been contaminated with feces from an infected animal. So I think in 2009, there was a peanut butter factory. There were deaths, I believe. I know there was a death for sure. I don't know if it was more than one person, but that was associated with contamination. So again, very, very important. Now, when it comes to a natural disaster, such as huge flooding event, we'll use Hurricane Katrina in 2005 as one of those examples as well, where damage, but really just widespread flooding, it takes a little bit of time for those animals to rebound. It usually takes about 6 to 10 months after the disaster for those populations to increase, so that you can have a greater chance of exposure. And so this is a little bit old, it's 2006. We're actually right now in the process of retrapping the city. And so we'll have an idea of how things have shifted over the time. But again, silos, right? In partnerships, this was a great example of working with Tulane University. Dr. Mike Blum was able to get a project, and the nori rat was going to be the indicator species for disturbed environments. So we learned a lot of different things, but just for us, just on that, the first thing we learned is, where are these rodents, right? And where do you find them? So the trap areas were in yellow, and you can see red is the nori rat, roof rat in blue. The larger the circle, the more they caught. And we had a few little cotton rats in there, but those are really not a problem at all. So very important. But what they also looked at was to see if they were carrying different pathogens. And again, remember those highlighted areas in yellow where they were trapping. And look, it seems like if you look, you find, right? And this happens to be Bartonella. It's not going to kill anybody. It's a bacteria, likely. But it can make you pretty sick. And so again, larger the red dot, yep, they found it. And the larger the dot, more prevalent. So very important. What I'm really concerned about is Leptospira, also found throughout the trap areas, associated with urination, right, of rodents. So it's shed into the environment that way. A great example of this right now is actually in the southern part of Brazil. They've had extensive flooding, I think 3 weeks to about a month ago, and there are people dying of leptospirosis. And so because they're going through the floodwaters, you might have an open cut, sore, something like that, and the bacteria gets into your system. So if you're out there and you're working in a particular place, you need to be wearing closed-toed shoes, all right, so that you don't become potentially infected. There have been cases in New Orleans of leptospirosis, not too many, but it is in fact there. So lots of again, look, we need to understand what the contributing factors are, right, so that we can deal with these things. But this is on the large scale of why you may have some pest problems, vectors, and disease. And look, a lot of times people like to live in the woods. And so again, depending on where you are and what pathogens you're looking at, you may have that animal cycle, for example, primate cycle with the mosquito, and then all of a sudden you're in the wrong place at the right time, become bit by an infected mosquito, and now it's jumped over to humans. Increased population density. What does that cause? Increased trash, right? Increased stress on that infrastructure. So very important, urbanization in general. And then old and aging infrastructure. If you have, especially with rodents, if you have sewers that are broken, for example, those are just sort of vehicles, highways where these animals can live. Increased poverty, poor hygiene levels, access to healthcare. Very important, even in urban areas, healthcare might often be an issue as well. Resistance to pesticides, we really don't have a lot of idea what's happening with second generation anticoagulant resistance here in our region. We hope to change that actually, but very important. But when it comes to mosquitoes, it's very important to do that too. Again, training, very important, right? You guys are all here today. We appreciate your time to spend with us, but you need to have a lot more expertise in training and vector control and really understanding what vector control is so that you can communicate to other folks and really advocate for this industry so that people understand the importance of it. Oh, I don't know how to change this one, right? It's the lack of public participation. So those educational campaigns, all those things we do, but look, everybody seems to be busy and they've got lots going on and they're driving to go to soccer or baseball or football, whatever it is. And it's really important for people to spend a little bit of time in their own yard and get rid of those conducive conditions. And those are often a big issue. Construction, we haven't been able to crack that nut either, but there are some wonderful documents that came out of San Francisco some years ago on how to build out pests at the construction level. So very, very important. And we just touched on this already before, but climate change and those increasing temperatures. So this might be very important, right? With enhancing and expanding the range, for example, of roof rats, which require warmer temperatures. So very, very important as well. All right, so let's go back and look at, from a rodent standpoint, some of these individual, I would say, components of what an integrated pest management program is and see, hopefully give you some ideas. All right, so I just took a slice in time. This happened to be in 2017, but the city of New Orleans has a 311 system, and we actually have given the script to the 311 operator so that they ask the questions that we need and really ask for even permission on getting on the property because unless it's an emergency declaration, we have to follow certain procedures. And so again, but what you can do with this data is you can start to look at clusters, right? Of where are there more service requests coming in, so you can try to figure out why that is happening. And when it comes to rodent-borne diseases, there are unfortunately more programs that are doing this, but if you look back into the 1950s, I don't have the picture here, but there were a lot more programs many years ago, 50, 60 years ago, with rodent control. And even in the city of New Orleans, working with the state health department, they used to do surveillance for murine typhus in the 90s. But with funding being cut, all of that is gone by the wayside. So you know, there just sometimes aren't the local resources, so we all need to really advocate for those resources to be there so that we can show how important it is that we're protecting human lives as well as, you know, animals. But there are different ways that you can get information, right? So in our case, we partnered with, in our case was Tulane University, but there are different districts in the United States that do some surveillance, but also partner with other universities. And again, for the folks that are in Texas, you need to be paying attention to murine typhus, and actually Louisiana and other states as well, California and other states. And so, you know, you have rodents, you have murine typhus that might be associated with rodents, but also with possums. And so, but the cases are going up. And so very, very important to look at, actually look at 2018 at the bottom where the arrow is, 40 cases. Only 12 are confirmed, but 28 probable. So we want to make sure that the physicians understand what the symptoms are, so that if somebody comes in with some of these symptoms, hopefully they'll actually have the right test done to get it checked out. You have to have the ability to do some molecular diagnostic tests, right? So fortunately, hopefully you can have equipment that's there and sort of double duty with that equipment. A lot of these procedures are pretty similar. But you have to have the capacity to do some trapping, take tissue samples, and everything needs to be done in protocols and follow, you know, certain protocols so that everything is done correctly. Sanitation, know your rules, right? So for the folks that are environmental health workers out there, state sanitarians, you need to look at the outside of the building and let's educate everybody. This is not okay. And so you can do all this work on the inside, but if you have the trash outside, you're likely going to continue with those rodent control program or rodent control issues, not only for that particular property, but for the neighboring properties as well. And so one of the things here is look at your local laws. And so we created a dumpster guidelines. This is a magnet that we hand out to people, but then also bringing to the forefront that proper dumpster management is rodent prevention. I believe I do have the information about it at the very end of the presentation, but if not, I think it's later this month, we're going to be I'm giving actually a presentation to business owners and folks that do tourism. So if you're interested, just make sure that you text in there or email education@nola.gov, and we'll make sure to get you the link for that particular presentation. But that really is going to be focusing on the local municipal code and these environmental conditions that are contributing to pest issues. For the folks that are working in state and municipalities, working in encampments is very, very important when it comes to managing rodents as well. We want to try to keep everybody so that they are not exposed to rodents. It is challenging. Typically, we don't use rodenticides in there. We do a lot of pest proofing. Actually, you can see these are elevated platforms for us, so we'll actually use concrete to close holes. But we also use carbon dioxide. It is allowed in our particular area through tanks and also through the dry ice formulation, but you need to be a certified pesticide applicator. So please go back and look at your local rules and see what products are available in your particular area for use. Now, when working in these areas, I will just put this out there, make sure that you are wearing your proper PPE. You have to be careful of needles and human waste. And again, don't work in silos. I mean, break those silos down. And again, as I mentioned, when we have a lot of agencies that are working together, you're really able to go in and do really good servicing for that particular area. All right, so let's talk a little bit about pesticide reduction through trapping and the use of rodenticides. So again, very important tools that you need to have available. You need to check from a preparedness standpoint. Do you have pesticide applicators that can do this work? Trapping, you don't need to be a pesticide applicator, but if you're using any kind of pesticides, look at your local laws for your state and make sure that you're following them. All right, so trapping is very effective. You know, a lot of times we are even educating our public on how to trap for themselves. So that we typically don't go inside of homes. That's really left for our private industry, but there's some folks that cannot afford that. And so we do work with them to teach them how to trap. But you have to know a little bit of biology. You cannot do sloppy work, because when you do sloppy work, especially when it comes to rodents, you're teaching them to avoid your devices. All right, so very important. In this case, you can see the bottom here. We had a few folks, we were actually pre-baiting, which means you're essentially feeding those animals on those traps so that they're not afraid of those traps. And then all of a sudden you set them and you sometimes get a whole lot of them, as you can see in the bottom. And when it came to COVID-19, right, so you can see we're actually on Bourbon Street here. There are very few people out there, so it really allowed us to work all over this area. And we actually did use second generation anticoagulants here. But again, read the label. Make sure that you're putting the right amount into those bait stations. You do not want to underbait. You want to make sure you're reading the label, following instructions. You're coming back and actually looking and checking those stations on perhaps a frequency that's more than once a month. It just depends on what the scenario is, so that you're being effective and are able to really manage and decrease those populations. And as I mentioned, sometimes we do pest proofing. So you just need to look at each scenario. These were elevated parts here with soil underneath. And in this case, all we really needed to do was to close those openings because of all concrete around, the rodents weren't able to get out. If you have this available, I know some places in the Northeast, California, but a lot of places will have CO2 gas tanks available, formulation available. So just make sure you check with your local distributors or your local Department of Ag to find out what is there. But this is a great tool in that it's pretty fast. You don't have a residual. And there's also a variety of different locations that you can use it, especially a more sensitive location, especially at those encampments. So the whole theory here behind it is that carbon dioxide is going to be heavier than air. You're going to have to be very quiet and, methodical. And when you're doing this, there's certain ways of doing it. But the whole point is that the CO2 is going to fill the burrows from the bottom up and kill the rats that way. So when we talk about preparedness, right? So it's usually you're thinking sometimes a year, 3 years, 5 years, 10 years out. And one of the things that is very challenging, because things just cost a lot of money, is looking at what infrastructure you have. And so this particular case is a picture from years ago. It's been changed, but it's a sidewalk, that pathway, that's a rat run. So it was being utilized by rodents up and down, going to that garbage can that was open, that had trash inside. So almost like a feeding trough. So if you have the ability and the funds, right, to work with other folks to really look at what kind of open trash cans you have, hopefully you can start to transition to trash cans that are closed so that you're essentially removing that food source. If you cannot do that, then you really do need to look at removing that trash and not letting it sit for extended periods of time. So increase the frequency of the trash pickup. And so many places in the United States have now moved to those residential carts, which is really great, right? But you need to also educate folks to leave the lids on and leave it closed, because essentially that's just an opening for rodents to go in there and feed on that trash that is in there. The other thing that when I see this picture is that the cans themselves need to be washed on a regular basis, because that residue, that goo that's on there, that's also going to feed these populations of rodents. And so in the city of New Orleans, they were started being introduced back in 2007. I think that this actually has made, we don't have hard data to really quantify, but I do believe it's made a big difference over the course of time. And so again, other agencies started adopting, especially these closed cans. They're very expensive. And in 2015, they really started also transitioning to other locations. But I will say in this bottom right-hand picture, you have to be pretty strategic about where you put it, because you can see a big closed, beautiful garbage can right there, but next to it is an open one. So what I think should happen here is that if you're going to have garbage cans, they really do need to be closed. Both need to be closed so that food source is not there. All right. So I'm pretty sure you're probably thinking like, oh my goodness, where do I start? Because that's how I felt, right? Many years ago. And so, and I still feel it actually. And so you have to really start thinking about where do you want to go, right, with all of this. And so for me, 1 year planning is very important. I like to have 3 years, 5 years, and where do we want to be as a program 10 years from now? It's very important for the leadership to set these milestones for each year, and actually these long-term goals as well. Often there is change at the top in leadership. So somebody sets goals, and then next thing you know, there's a whole new set of administrators come in and they've got a different set of goals. But it's very important for those folks that are making those leadership decisions to really think out the years and where do you want to go, and really well define why it needs to be there. You have to train or hire employees that have the skill sets that you need. And this takes years often, right? To really look at all of your employees that you have and what skill sets do people bring to the table, so that you're able to, again, break down those silos and have the skill set that you need to pivot when emergencies come up. This all helps you build local capacity. That might be equipment, that might be people, right? And it might be insecticides that you have on staff and on hand. It may be a lot of different things. It might be a building. It takes years. It has taken us, we just in December 2022, we purchased a helicopter, but it took 10 years of asking and explaining. And we finally got it, right? So you have to set those goals, and they often take a long time to get there. Well, how do you do this? How do you find money, right? Because I think that's what everybody is looking for. Sometimes it's to improve the way you do things. You may be able to trim somewhere and be a little bit more efficient by maybe how you handle data, or how you do, maybe you have a piece of equipment, right, that helps a little bit more reach a larger area, whatever it may be. Of course, we're always going to ask for those increased budget requests, right? And if you can acquire grants or even jump on to different projects that might be out there, especially with your local universities. You might do product testing, for example. I know quite a few districts do that, but very, very important are those collaborative projects. And so finding those university folks, and that really requires a lot of conversations to see where they may have some alignment in goals. Because the one thing that the boots on the ground folks bring that the universities cannot do is just a workforce behind to collect great information. And so it really becomes a wonderful partnership that you can have and maintain over the years. So all of this has led to, and I'm almost done, but it all has led to a wonderful project that we were able to acquire last year. It is funded through the Centers for Disease Control and Prevention through the Department of Health and Human Services. And the project here is coordinated training and evaluation of professionals and pre-service students to achieve an integrated workforce to mitigate community vector-borne disease in the Gulf Coast states. So the primary states are Texas, Louisiana, Alabama, Mississippi, and Florida. But there are a lot of other folks that are involved in this project, actually nationally and internationally now as well. And so for all of you that might be interested, it's a really great opportunity for training. We are conducting needs assessments of vector control programs as well as surveys of districts, but we're also working hopefully soon with our pest management professionals to really understand what you do and how you do it. We're working with students. There's lots of travel grants that are out there that you can apply for. So if you're interested, we actually have a landing page now. So it's called vectoroutreach.org. You can go there. There's a nice little video that talks about what we're trying to do. It's a 5-year project. We're just at the very end of year 1. Year 2 starts in July. So there's a QR code if you'd like to learn more about the program and receive some updates. Just use a QR code to sign up. So with that, Stacy, I'm going to kick it back over to you.
Okay, I'm looking in the chat to see if we have any questions for you. I don't see any questions in the chat right now, but we'll give people a minute to type. But while you're typing any questions, our next part of this series will take place on June 24th at 2 p.m. Central Daylight Time, and we will have Ms. Meredith McInturf from the New Orleans Health Department speaking on the role of public health preparedness before and after an all hazards event. That webinar is also approved for Louisiana sanitarians to get CEU credit. So if you would like to register, it's the same link. I still don't see any questions, Dr. Rigo. So once again, thank you for hosting the webinar, and thank you everyone for joining us today. Have a great afternoon.
Thank you.